The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. This is Tom Schutz from Group Services, and thank you for joining us today for our webinar session on private exchanges. We appreciate you joining us, and we're going to work hard today to make this an hour that is well spent for you and an hour that gives you a lot of information in terms of welfare reform, healthcare reform in private exchanges. So today's webinar, Private Exchanges 101, is part of a webinar seminar series that we've been hosting on your response to healthcare reform. And just by way of an overview, we started out the series with a seminar on ERISA compliance in July, followed that up with a webinar on the 1st of August on group health captives. We're at today's private exchange webinar, and our final part is claims data analytics. And just a short note, I want to let you know that that was originally scheduled for this Thursday, the 12th of September, and we have moved that back. We have rescheduled that for September 26th. We've got some additional information developments. We just needed a little more time to wrap that into our presentation. But today we're talking about private exchanges. Before we go into that, I want to just take some time, just a short period of time, to just do a brief overview and a summary of what we've learned so far in our series. Some of you may have attended. In July, we hosted a seminar with Carolyn McNary from ERISA Edge, who is one of the preeminent ERISA experts in the entire United States. And some things that we learned, the key points that we learned from that seminar. First and foremost is the Department of Labor is significantly increasing their level of activity in the area of welfare benefit plan audits. And you're going to hear me refer to welfare benefit plans, and let me just clarify what that means. If you look in the world of benefits, you have what we think of basically, there's two sides. There's retirement benefits, and then there's the other benefits that you typically offer as an employer that are referred to as welfare benefits, like your group health, your group dental, your group life, your wellness programs, that type of stuff. And so what we've learned is that there's significant activity in the audits for welfare plans. We also learned that based on Department of Labor statistics, approximately 95% of those audits result in at least one employer violation. And we found that the violations typically center on three areas. The first area, and probably the most common, is the lack of a qualified and compliant summary plan description, the requirements of which are clearly set out in the ERISA regulations. Through the years, many of us have thought that the benefit booklet that we get from the carrier would suffice as a summary plan description. What we now know is that's not the case. And so typically what you need to have in place in addition to that benefit booklet for each of your benefits is a separate compliant summary plan description that discloses all of the information, plan year, plan sponsor, etc., that the ERISA regulations require. So the first thing is to double check, do I have the appropriate summary plan description or descriptions? The second thing we learned is that typically, even if there is a qualified summary plan description, the next area where most problems arise are in the distribution of those summary plan descriptions. Regulations are very clear on who they need to be distributed to, when they need to be distributed, and how. And the how is typically in paper or electronic format. It can be done electronically, but there are some steps that have to be followed. And so we found that in many instances, violations surrounded or involved that method or frequency of distribution of that summary plan description. And then going along with that, and something just in terms of being audit ready, the other issue is you also have to be able to show who you distributed to, how you distribute it, and when you distribute it. So it's a record-keeping requirement. So you could find yourself in a disagreement with an auditor if you've done everything right, but you just don't have the records that show how you did it and when you did it. So point 2 is to be aware of those. We have to think about the preparation of the summary plan description, the distribution, and then how we do our record keeping. The third area that we learned was involved the Form 5500. And if on the welfare benefit plan side, if you have a plan or plans that have 100 or more participants, then you're required annually to file a Form 5500. And so the government has again stepped up their oversight, and one of the things that they're doing is on the retirement plan side, no matter what your size is, you have to file a 5500, even if you're under 100 participants. And so what the Department of Labor is doing now is they're cross-referencing within their system. So if you file a 5500 for your retirement plan, and they see from that it shows 100 or more participants on the retirement plan, then they are cross-checking to see if a 5500 was also filed for the welfare benefit plans. And if not, then we just saw it recently. In fact, one of our clients was the first in Iowa that we're aware of to get one. You'll get a little love letter from the Department of Labor. It says, hey, we saw you filed here. We didn't see you filed here. What can you tell us what's going on? And that's a significant issue because failure to file a 5500 on a timely basis can be is subject to a penalty of up to $1,100 per day for every day that the 5500 is late, and there is no statute of limitations on that. So if you have not filed a 5500, or if you filed one improperly, because they treat an improperly or incorrect 5500 the same as if it were never filed, then you could be subject to that ongoing penalty for all of that period of time. Now, they do have a voluntary delinquent filer program where you can minimize your risk, but you just have to be aware, do I have that requirement? Do I have 100 participants? Should I be filing a 5500? And then if you are required to file one, then the final step is you also have to provide your employees with a summary annual report on an annual basis, which has to be distributed the correct way as well. So the bottom line is, very complex area, something that the Department of Labor and the IRS are both focusing on. So it's really important that you think about getting yourself in an audit-ready status. How do I get all the documentation that I need to have? How do I have it in a ready format so that if I should get audited, which according to the government goal, they want to audit every employer's plan, welfare benefit plan. So it's not an if, it's probably a when, then that you can handle that audit readily because you have all your information and you're tracking your distribution. So a big area of change in terms of welfare benefits. The second thing we talked about was a new funding concept, new to the group health concept, called group health captives. And captives have been around for some time, but mostly in the work comp, liability, professional liability area. They've made a move into the group health arena since the passage of healthcare reform. And the best way I can describe a group health captive is to share with you kind of a story. But for many, many years being in this business, I've commonly had people say to me, Tom, isn't there any way that we can join together with other employers, because we know bigger numbers will automatically give us more negotiating power and better rates? Well, in many respects, that was a myth, because big numbers didn't automatically mean more negotiating power and better rates. It was dependent upon how the large numbers were created. And so if there were several employers and they weren't structured properly, then it really probably did more harm than good. Enter the group captive. The group captive, the group health captive, does have the ability to make that statement true. And it's for the first time, really, since I've been in the business, that it creates an opportunity for employers to band together to increase their purchasing power, reduce their risk, and actually put themselves potentially in a better position to manage their cost on the health side. Now, they're not for everyone, but there are a couple of different ways you can get involved in a group health captive. One is you can start your own captive. In fact, we have a client that is trying to do that right now. And when you start your own, you're out trying to look for like-minded employers that are interested in accepting some risk and are interested in gaining more control over their ability to manage their health costs. And so you can structure that however you want. You can be very narrow or not. Typically, it's going to be you're going to require wellness. You may require a certain plan design, those types of things. But that's one way. The other way is you can join an existing captive. We call it a rent-a-captive. That's kind of our term of endearment. But basically, there are captives that exist, and we actually are involved with 3 that are available today. But you can get involved with captives that exist. You can join that captive. You can take advantage of the buying power of the captive, the ability to manage cost. Typically, the rent-a-captive is not as restrictive in terms of what it requires in terms of plan design and those types of things. And oftentimes, it's a very nice way to get into the captive environment. And then while you're in the rent-a-captive, you can form your own captive, and then you can pull your group out of the rent-a-captive and start your own. So they're not for everyone, as I said. However, we think it's something that everyone should be aware of. It should be part of your strategic discussions about where am I going to go with our health benefits, how do we respond to healthcare reform, and is this a strategy or a tool that we need to be thinking about. So on both of these, if you want more information, just feel free to contact with us. We'll be happy to help you sort through and understand what's going on. So that moves us to today. Today's webinar is on private exchanges. Interesting concept. I'm sure many of you have heard much about, and we're very fortunate today to have with us to walk us through and help us to understand what is a private exchange, what does that term mean, what are the components of a private exchange, is we have with us Jamie Hawkins. Jamie is the President and CEO of Benefit Technology Resources. We're very pleased and happy to have Jamie as one of our partners through our partnership in the Benefit Advisors Network. And one of the nice things is Jamie knows her business, frankly, as well as anyone. And she's been instrumental in helping employers identify how technology in today's marketplace can streamline the ways they administer the entire back office functions. And I know Jamie will touch on this. This has changed significantly in just the last couple of years. Jamie has 17 years of industry experience and over 13 years specializing in employee benefits technology solutions. And as you hear Jamie and she goes through her presentation, it'll become very clear to you the expertise that she has. Before I turn it over to Jamie, I just want to touch on a couple things in terms of the format. Jamie's presentation will be about 30 to 35 minutes, and then we'll have time at the end for questions and answers, and then I have a couple of closing comments. So during the course of the presentation, if you have questions, you'll note usually the box on the right side, there's an area where you can type in and pose questions. And so I'll be watching for those, and if I think it's pertinent to our discussion, I may interrupt Jamie. Otherwise, I'm more likely to save those to the end, and then we'll spend some time addressing all of the questions that exist and that may arise as you listen to Jamie's presentation. I also want to let you know that we are recording this webinar. I also want to warn you, I tried this one other time and it didn't record, but that's the first time it hasn't happened or hasn't recorded. And so we will also let you know after this webinar where you can go to download the recording. So Without further ado, I am going to turn the presentation over to Jamie Hawkins.
Thank you, Tom.
Jamie, it should be all yours.
All right, very good. Okay, and can you just confirm that you can see my screen?
I can see your screen.
Okay, perfect.
Yep.
All right, well, thank you, Tom. We're excited to be talking here today with everyone, talking about public and private exchanges and what this means to you all. So I'm going to go ahead and just jump right in. The agenda today is really covering how these public and private exchanges differ. What are they? How do they work? And we're going to be looking at what the impact is on you all, the employer. We're also going to take a look specifically at a private exchange and show how other employers are seeing this as a new way to look at company benefits. So first, just a little bit about us. We are the leading mid-market HR technology consulting firm in the country, and we work with employers that have 50 to 5,000 employees, helping them leverage their HR technologies. And we've got several folks that are on our team, ranging from HR consultants into the implementation side as well. We do support clients who are going through the implementation of a new HR technology. But let's go ahead and get started on the private exchange side. We've had a lot of employers who've come to us and said, Jamie, what is a private exchange, or the government is calling them a marketplace? What are these? And really, for those of you who have been around for a while, you'll remember back in 1978 when cafeteria plans were first introduced. And it was really a way where an employee could go through and pick and choose the benefits that they wanted. A private exchange is doing the same thing. The only difference is it is adding state-of-the-art technology, and now you've got what everyone is referring to as a private exchange. So if we look at the different types that are out there, I think the first difference that we can really help employers hone in on is how the public exchange or the individual exchange differs from a private exchange. So first being, the public exchange is really geared to an individual. It typically is going to incorporate medical only, but it will have multi-carriers. So this may be an environment where you have a Blue Cross and a United for medical coverage for an individual. The shopping experience or decision support tools are for the health plan only, and typically this plan is going to be paid by that employee through a personal check or credit card and or through a subsidy. With a private exchange, it is a group-based or employer-based technology. And the plans that are offered are more than just medical. It's usually the whole health and welfare offering, many very similar to the benefits you offer today, where it may be medical, dental, life, health, and so on. What we are finding, though, on the private exchange side is typically one carrier, medical carrier, is offered, but multiple plans. So you may have a Blue Cross medical and maybe 6 plans for the employees to choose from. The shopping experience really incorporates the total benefit package. So the employees can understand how much life insurance they need, which dental plan may be the right one for them, in addition to the medical decision support tools. And then lastly, where does the money come from? Typically, the employee is paying for the benefits through employer contribution, and the employer is collecting the premium through payroll deductions, very similar to how that's done today. There are several components that drive a private exchange that we'll talk a little bit about. First and foremost is the employer contribution. So the employer determining how much they are going to contribute towards benefits for an employee. The second component is the consumer shopping experience. Think of it as a benefits mall. The employee has to go in and pick and choose the benefits they want in a shopping experience. The fourth component is the technology and administrative support, and this is where the employee is able to enroll online, the decision support tools are online, all helping that employee make the decision. And the second component are the carriers and the products, which are very important. You've got to have the carriers and products available to the employee to make all of this work. We also have had a lot of clients who have a benefit administration system, which is an online enrollment system today, through ADP or maybe through Ceridian or some company like that. And they're trying to determine, how does this system I have differ from a private marketplace? So we thought we would give some examples of differences in how these two systems will work. On the benefit administration side, or online enrollment, defined contribution is only used sometimes. The products and carriers are just what you all typically have today. It's one-off per employer, meaning your plans, your contributions, your carriers are unique to your organization. And those plans on the medical side can be either self-funded or fully insured. Automation is focused on because you are using technology to enroll, but it's lighter on the decision support tools and the employee engagement. And on the benefit administration side, some of the a la carte options like a call center and billing are just that. They are a la carte. On the private marketplace side, it's using, in essence, the same technology, but it is almost always deployed with a defined contribution. So you're telling the employee, we'll contribute $6,000 towards your benefits, and that's how they go through the decision support tool. It is typically more cookie cutter. So if you are interested in Blue Cross, there may be 5 plans on the private exchange that are Blue Cross plans, and it's fixed. So that's the menu that you and your employees would have to choose from. And most often the plans we see are fully insured rather than self-funded. Automation is a given, but there is a much higher degree of decision support tools for the employees and employee engagement. And typically the tech and admin support, the call center for employees, and help with billing are embedded in a private marketplace or private exchange. So then why is there all the buzz? What is driving employers to look at this solution and be interested in this solution? I think really the top 3 bullet points outline this concept best. Employers like it because they want a true budget for benefits. They want to be able to tell the employee, here's the dollar amount, you pick and choose what you want. And employees like that. They want choices. And lastly, the employer really wants out of the administrative headaches. You all are dealing with enrolling employees, keeping track of who's enrolled, who didn't enroll, why didn't they enroll, and then getting that data to the carriers. With a private exchange, all of that manual processing goes away, and it's all done online. This is a great quote by Darden Restaurants, who moved forward with a private exchange earlier this year. And they said, they like to think about healthcare as being more of an innovator. They're taking the opportunity to jump on this first. And they wholeheartedly believe that it's going to be mainstream how employees access healthcare within 2 or 3 years. So it's a great time for you all to be looking at it and considering this as part of your strategy. So how do you make an exchange work? The real important part is it is centered around the employee more so than ever before, because that employee is really the one making the healthcare decision, where in the past it's been the employer that had to make all the decisions. It still incorporates the broker advisor role. That is very much needed. The employer role, making the contribution decisions. You've got to have the technology provider to power it, and then the carriers that are selected. These are also just some interesting perspectives from different employers and why they're moving in this direction based on research that is available in the market. Many employers are overwhelmed by the regulatory environment that PPACA created, and Tom certainly hit on that earlier. And you all know the government really has not provided tools to you to deal with this. Many employers want defined contribution. They love the concept, but they are hesitant to be the first ones in their market to step out. Also, employers are trying to figure out their benefit value proposition. Should I be offering benefits? If so, how do I predict and manage my benefit costs? And meanwhile, they're doing all this with increased oversight from the governmental agencies that Tom talked about. Overall, employers are expecting higher costs, and they're trying to focus more on wellness and the defined contribution model that we talked about, but they know to do that, they've got to have the credible decision support tools to help employees. The carriers, this is also causing confusion for them. The carriers, the Blue Crosses and Uniteds of the world, are really navigating new territory. They are too resource constrained and overwhelmed with requests. And some of these carriers are putting together their own private exchanges. The problem for you all is it most likely will only contain their products, so it won't be a one-stop shop, which in a perfect world is what you all would want. The carriers are also trying to figure out if their exchange is going to be geared to the individuals or to groups, and they're having to expand their plan choices. I mentioned before, in some areas we are seeing 6, 7 plans offered by a carrier that would be deployed to an employee, so they could choose from all those plans. We also talked about underwriting and how it's changing. Tom and I were just catching up before the call. Now for quoting, some carriers are requiring that the employer provide dependent information. And a lot of employers haven't tracked that up to this point. So this is all changing, and we are seeing that carriers are trying to build their brand name. They really, where before based in Florida, and I know Florida Blue buildings have been popping up all over where consumers can go in and learn more about the plans that are offered by Blue Cross. On the technology vendor side, folks like ADP and PlanSource and bSwift and various platforms that are out there, they're facing challenges as well. Many of these vendors have true end-to-end solutions, and the reason is they are lacking carriers and stores. They don't have the carriers embedded in that technology, and they really lack strong decision support tools. They too are overwhelmed by requests, and they understand that they've really got to pull all of this in to the technology, the defined contribution, the products, the decision support, and the admin support, and they need to be sure their system is tracking the PPACR requirements. They also foresee challenges with integration and with product placement, getting the carriers to play with them. So then if there's so much turmoil, what's out there? There are solutions out there in the market, believe it or not, that are available to you all. And as we wrap up this call today, Tom's going to talk a little bit more in detailed fashion about these providers. On the carrier side, Bloom, which is WellPoint, and the Blues, they do have exchanges that are available, as well as Blue Cross Blue Shield of Illinois is deploying theirs in January, and United and Aetna are coming to the table as well. On the broker-driven exchange side, these are available in the market through technology providers like bSwift, PlanSource, Benefit Focus, Business Solver, Employee Navigator. These are just some that are out there in addition to the big consulting firms. It really is looking like the Wild West on the exchange side, because you've got the technology providers that don't have a store or carriers, but you do have a provider that is in the marketplace and available to you all called Liaison. And they are unique because they already have the employee consumer experience built in, and the store of carriers is built. So we'll talk a little bit more about what that looks like, but just know that name, and that really in the marketplace today, they are out in front of this private exchange world. We also have talked a lot about carriers that are willing to subsidize this, and yes, there are but just remember it's not really free. What they're doing is subsidizing this to tie you to them, and that they would then own and control the data. So it's not as preferred as one might think. You always want to look at what the strings are if they are providing that technology. We also have had a lot of employers who've said, you know, Jamie, what from a cost standpoint does this look like? So we wanted to give you some estimates from a cost perspective. Most of these private exchanges are going to have a setup fee per employer that ranges from $0 to $10,000, and that's a one-time setup fee. And that setup fee really takes into consideration all the plans that you want included, your contribution or defined contribution amount, the eligibility, you name it. This is to set it up for your organization. There is then a per employee per month cost, and this would be for employees that are eligible for benefits and that go online and enroll. And that is a monthly fee. Basically, you take that dollar amount, that $350 or $450, times the number of employees you have, and that would get you your monthly cost. The last piece are the carriers in the store. Who's got to bring that to the table? And you'll see that on the carrier side, the first three don't have the carriers in the store set up. That would still have to be brought to the table. Where with Liaison, they do have the store configured in many states and regions. And again, we'll talk a little bit more about that as we go through this. On the carrier side, we mentioned a few that are out there, and of course others are forthcoming, and we're even going to see some of the ancillary providers getting into this space. We're already hearing a lot about it today, so it's going to be more than just the health providers. If you are considering a private exchange, what are some of the things that you should really give thought and consideration to? First is, how long has this provider been in the exchange space? You don't want to partner with someone who's not done this very much. So knowing their experience is going to be really important to the success of your project. Also understanding, are they compliant with PPACA? Most of the good systems are. They're going to help you track all of the requirements that, that you need to right within the system. You also want to understand what decision support tools and what carriers and products they have, and what administrative functions are they going to take off your plate. Are they going to be sending data to your carriers for you? And also, how is their system secured? The primary audit that is done on these technology providers is an SSAE 16 audit. It's the former SAS 70. And being sure that any provider you are considering has that certification in place is really, really important. You're going to have employee data out on the web. You want to be sure that the provider is holding it in a secure manner. It's also just good to ask the provider how much business they have on the exchange platform and what's being added to the platform. It's important to understand their growth strategy, because if they're looking to grow rapidly, anyone who's gone through that with a provider knows that sometimes that can be painful, and it would just be good for you to have visibility before entering into a relationship with a company. It's nice to see a visual of what these private marketplaces look like, so I've got a few screenshots that we'll go ahead and walk through. So what you'll see here is an example of an insurance mall or a private exchange where the employee comes in and they can pick and choose from all the different benefits that are offered. Up to this point, healthcare has been a challenge for HR, because at renewal, really the options were, when faced with an increase, the client could pass on the cost to employees. Not ideal. They could cut or decrease benefits, again, not the best option. Or the employer could decide that they were going to spend more on benefits. These three choices really aren't the best. And the employer also sat there saying, Why is it my job to pick one plan for everyone? Inevitably, I'm over-insuring some people and under-insuring others, and this really doesn't make sense. I'm also trying to get buy-in from the employees, and they don't always buy in to this strategy that we're deploying. With a private exchange, you can really imagine a better way where employees pick what they want so that everyone really gets what they want from a benefits perspective. And the flexible options that are available let the employee choose. So I can come in here to the health side and I can pick the medical plan I want, if I want supplemental health or dental or vision or a wellness plan or telemedicine, a teledoc program, I can select that. If I want to enroll in my FSA or HSA, I can do that. And if I'm looking for life insurance or disability, legal, or pet insurance, those are all typically options in a private exchange. The two areas that we see employers deploying, one is that the store is ready to go. So all of these are set up. You basically say, push that pre-stock store out, and we're ready to run with this. There is also an option where you all can customize these offerings for your employees. You can even make it look similar to the benefits you have today so that it's not so much of a transition for them. And that's what we would call a custom store that is specific for each client's needs and desires. And it really does result in a better way for both the employer and the employee. On the employer side, you all are only making one strategic decision. How much money do I need to contribute towards employees' benefits? And it's a predictable budget. You know how much you're going to spend year over year for that employee. Employees like it because they get to shop for the benefits they need in an online store, and the technology makes it easier for them, and it's personalized. These recommendations that the system makes are based on individual needs and support. So HR has said, this is great because it really, my role starts to look like those HR professionals that are managing the 401k, where you're selecting the percentage, but not necessarily the funds that employees can choose from. So let's look at this in how healthcare is impacted with 3 employees. The old way is every employee got the same thing. So everybody gets a point-of-service plan, basic dental, and company-paid life insurance. And for Chris and his family, the cost is $1,800 a year. The issue is Chris's son has asthma, and they go to the doctor a lot. We've then got Tom, who's got single coverage. His premium is $650 a year, and he's healthy. He doesn't go to the doctor very much. Lastly, we have Alicia, who again is employee-only coverage. Her favorite doctor doesn't accept insurance, and she's interested in more wellness coverage. When that employee can go through a private exchange, the new way is they pick and choose the plans, and they're personalized to them. So it starts with an employee completing a simple questionnaire. Tell me about your family, how often you go to the doctor, tell me about your needs. Then the system is going to give them educational information and guidance and personalized recommendations for the right plan. That employee can then go in and pick and choose the benefits they want, and then they're finished with their enrollment. And this just shows you when these 3 employees went through a private exchange, they selected very different plans. So Chris and his family decided to move away from the POS plan and into an HMO plan with copays. That saved their family $500 a month in premium. Tom enrolled in a high deductible plan with an HSA, and his premium dropped $100 a month. Alicia selected to go ahead and stay with the POS plan, but added a critical illness and wellness component to hers. So her premium went up by $25 a month. Over just these 3 employees, the employer saved $575 a month because of how these employees purchased their benefits. So you can see that can really add up. As we look at the attributes or components of a private exchange, just to reiterate, it's the money or the funding coming from the employer. It's also the store of benefits that is offered and the decision support tools and the end-to-end transaction processing for benefits. So getting those employees enrolled and getting that data to the carriers and payroll deductions back. The key is really personalization through technology and service. So only showing the employee the recommendations based on their needs and going through the enrollment, and then the robust employer and employee self-service. So employees can go online at any time to see what they're enrolled in, and employers can run reports right at the tip of their fingers. The employer wins because they save money at the end of the day and get that predictable budget they were looking for. But most importantly, they streamline all of the administrative tasks. No more paper enrollment and getting data to carriers. On the employee side, they like it because they're saving money, they're getting the right benefits, but more importantly, they're understanding and appreciating the value of their benefits because they're involved in their health care and making those decisions. With Liaison, the one provider that I mentioned does have the store set up and ready to go. This is what it looks like. On the medical side, the medical plans vary by carrier and by market. So you can see area to area, state to state even. This is going to vary with Aetna and United being their two dominant providers. On the dental side, if you go with their national store, it's going to be MetLife or Guardian, and so on. You can see for each benefit who is offered. So this is the concept where it is set up, it is cookie cutter, and ready to go. Typically, what the contract terms look like with Liaison is if you have under 100 employees, it is what it is. You can't make changes to the platform, and you can't include or exclude carriers. It is what it is. Over 100 employees, you can turn it into more of a custom shop where an employer is able to add or switch on carriers, plan designs, or coverage options. So you have a lot more flexibility over 100. The financial terms are pretty simple. The employer pays $6 per employee per month, and the only other potential fees are if you replace carriers or plans. Like we talked about, if you are going to customize the site, it's going to cost more, $1 more per employee per month, and $1,000 more for the carrier fees and custom plans. Just recapping a little bit as we wrap up, the services that BTR provides as a consulting firm, and if you all do have a need for this, please feel free to reach out to Tom and the group services team, and they can ensure that we get scheduled with you to walk through this. But in addition to helping with your private exchange strategy, we can look at your current technology to ensure it is compliant with healthcare reform. We have a checklist of the requirements where we basically can get your provider on and go step by step through everything that needs to be configured in your system. We can also work with your provider to look for efficiencies or gaps in the products to maximize what you have. Oftentimes we find clients have ADP, Ceridian, Paylocity, and maybe they just aren't maximizing their use of the system. And we can look at that and also your workflows as part of that. If you're having any problems with your provider, we can jump in and discuss those to see if there's a way to remedy them. And we'll also review your pricing to ensure it's competitive with what's available in the market. A lot of the costs for these systems have come down over the last 5 years because of technology is being deployed faster and more efficiently, and that drives down cost. For anyone who might want to look for a new provider, BTR can also draft, manage, and oversee the RFP process, where we will go out into the market, obtain proposals on your behalf, compare and analyze them for you. And then lastly, we will oversee the implementation and ongoing HR support of any technology that is selected. So with that, I'm going to pause and turn this back over to Tom. So bear with us just a second while I transfer the controls back over to him. Okay, Tom, great. You should have control.
Yep, looks like I do. Am I flying through slides?
Yep, you are.
All right, good. There we are. Questions. Okay, good. Well, we've got some time for questions, Jamie, and as it turns out, I've got some questions. So let me pose those questions. One of the questions I have here is, and I think you touched on this, but maybe let's go back again. How is this private exchange that we're talking about different than just upgrading my benefits or my HR administration system?
It may not be that far off. I would say if you already have benefit administration technology in place, sometimes we can make it look and act like a private exchange. So I would recommend before ditching that application and moving to another platform, let us look and see if we can modify it enough where it can become a private exchange. A lot of these technologies that are in the market have the capabilities, and obviously the technology vendors are moving as quickly as they can to ensure that their products can support a private exchange. So
okay.
come to us and let us help you determine if your current system can do that for you.
Okay, good, thank you. And see if you agree with this. Kind of the way I picture this, I mean, private exchange is not just a single thing that's out there, but it strikes me there are three components that an employer is probably going to want to look at. One component is the store or the marketplace that's available for the employees in the process where they're able to make their decisions. The second part is from the employer's perspective, is helping them understand and figuring out an appropriate way and amount to move into that defined contribution mode, if you will. And then in my mind, the third piece is really just what I'll call nothing more than a technology piece that pulls that all together and tries to streamline the administrative process as much as possible and takes that burden really away from a transaction process that the employer has to execute, and it's one that the technology executes. Would you agree with that, kind of those three components?
Yes, you're exactly right, Tom.
Okay.
You hit it on the head. Okay,
good. Jamie, what do you see in the marketplace in terms of sizes of employers? Are there segments of sizes of employers that you see there's more adoption, and that you think down the road that there's going to be a higher level of adoption of this? And are there other groups, for example, I'm thinking of the under 50 market, that are moving right into this new world of healthcare reform and some of the restrictions on plan designs. How are you seeing that develop in the marketplace, and what do you see happening going forward?
Yeah, and I'll try to segment it into categories as well. For the under 50 market, we aren't seeing many options there now, and that probably goes for under 100. The options are really much more limited, and as we talked about with Liaison, it is cookie cutter. So it's more going to be driven by what's out there that can just be bolted on or deployed as is for a small company. With employers that are 100 to 500, there are options out there, but obviously there's a cost. It starts to get expensive. Really the biggest interest, I would say, is on the larger employer side, and that's where the most of the customization can be done. but this is evolving on almost a daily basis. So I'm sure as the federal exchange is rolled out and different options are deployed by the carriers, there will be more for us to talk about. But that's really the market segment as we see it today.
Okay. And let me just add on to that, because I know that in the work that you guys do in terms of looking at systems and tying them together for employers, you spend a lot of time looking at ROI. And so one of the things you talked about in your presentation was essentially the cost for having the technology piece that brings in the efficiency. Have you seen any kind of studies, or have you guys had any experience on the return on investment in terms of if we deploy this technology and pay that fee, it frees up staff time that we can that can be deployed elsewhere? Is there enough out there to be able to substantiate an ROI on that?
We hear statistics. I don't know how much is documented at this point, but what we've been hearing is that typically the employee will buy down in coverage. That's where some of the cost savings occurs. Also in streamlining the administration. That's a big piece of it, because even employers that are really detail-oriented, when you are having to key in adds, terms, and changes into multiple carriers' websites, there's room for error. So the larger return on investment we are typically seeing is there on the administrative side. Studies say it can be anywhere from $5 to $19 PEPM in savings, depending upon how well that employer was keeping records paper-based.
Okay. Okay, interesting. You know, I sat in on a webinar. One of the organizations you mentioned was Bloom Health, and I saw some statistics from them relative to at least part of what you talked about, employees buying down and employee buying behaviors. And in their book of business, what they found is when a private exchange was first rolled out to a group of employees, that actually 66% bought less coverage, 23% bought similar coverage, and 11% bought more coverage. But maybe even more significantly, what they found then at the first renewal subsequent to that was that 70% of the employees kept their same coverage level. The 30 that changed their coverage levels, of those, 18% bought down and only 12% bought up. And then they also found that about 42% of the participants opted for HSA or consumer-directed plan designs. So I thought that was interesting. I think that just confirms exactly what you're saying. Left, I guess, for lack of a better description, left to their own devices, when we allow employees to make their own decisions, it's not necessarily the same decisions that we make. Right. And their level of satisfaction isn't necessarily the same either when we're making it versus them. We've got time, I think, for one or two more questions. How are you seeing the private exchange model work or not work when there are labor unions or bargaining units involved?
Well, that certainly adds a layer of complexity to it. And if you think about it, the whole objective with a private exchange is to streamline and standardize. And with labor and bargaining unions, you don't always have that choice. So I haven't had a lot of experience seeing that group incorporated into this process unless there's been just a general agreement and an acknowledgement to move to defined contribution. Typically, the unions want to define those benefits more closely than that.
Okay. Okay. Good. And then a last question, and then we'll have my closing comments. But I'm gonna try and summarize this question if I can. There are carriers out there that will let an employer offer maybe 5 or 6 different plan designs. But they probably aren't offering maybe the technology backbone. And by what I'm talking about is being able to transmit that enrollment information electronically between the carrier and the employer, et cetera. In your opinion, can an employer make that work as a private exchange without the technology backbone? And what do you see as the advantages or disadvantages of trying to do that?
Yep, I don't think you can make it work without the technology backbone. The efficiencies that are created with a private exchange are really important from an enrollment perspective, that you're offering these plans in an electronic environment where the employee can learn about them online and compare them easily online. Also, the administrative tasks really aren't administered electronically if they're not, if they're not part of the system. So I would think that that would be nearly impossible to do without a technology backbone.
Okay. So really, if I can language it a little differently, so a private exchange is a lot more than just offering a bunch of different plans.
Yes.
And so when we're talking about private exchanges and we're using that terminology and we're talking about the advantages that it could bring to an employer, it's only going to bring those advantages, and it's really only that private exchange definition that we're looking at, is if you're also taking advantage of the efficiencies that the technology brings along.
Exactly.
Okay. Okay, good. All right. Well, Jamie, thank you very much. Let me close this up today, but I'm sure that if anyone has additional questions that they may have about this concept, how it works, those types of things, if they'll let us know at Group Services, let anybody at Group Services know what your questions are, Jamie, I'm sure we can carry on this conversation on their behalf with you. Is that okay?
Absolutely. That sounds great.
Okay. Well, let me close this out. And Jamie, I know that you have another appointment, and so if you need to close off, please feel free to do so.
Okay. Thank you, Tom. Thanks, everyone. Yeah. Bye-bye.
Okay. Well, let me close this out today. There are just a couple things that I want to bring everybody up to speed on in terms of our marketplace here in private exchanges and what's happening, and let you know what we know and let you know what also that we're doing in that regard. Jamie mentioned, for example, one of the things she mentioned was Blue Cross and Blue Shield of Illinois, for those of you that are based in Illinois, is planning to offer their own private exchange through Bloom Health, of which they are a part owner, starting January 1st. Now, that will be restricted to plans with 51 or more employees. So under 50, that vehicle, that private exchange, will not be available. We're also told that for groups of over 150, they'll offer their own, but they will also work with other technology vendors as well. Walmart Blue Cross and Blue Shield of Iowa, at this stage, have not shown a lot of interest. We've had some conversations with them. They've indicated they would look at it on a case-by-case basis, but it's not something that, at least today, they've shown a lot of interest and that they necessarily see for an advantage to them to be involved. United Healthcare and United Healthcare of the River Valley, we've had several conversations with them. I think I would describe it as they have some interest, but at this point they've not necessarily seen that it provides an advantage to them. They have indicated that, we already will, you can offer 5 or 6 of our products, and so it kind of does the same thing, but as you heard Jamie say, not necessarily true because you don't have that advantage of the technology backbone. We're continuing to have conversations. They have invited that. We know that United Healthcare has participated in private exchanges, and they have with Liaison as well, who Jamie also mentioned, in other parts of the country. And so it's just a matter of how much interest there is. And then self-funded plans, if you're self-funded, certainly it's available. It's a matter of tying in the technology piece and making sure that that's available. So that's kind of where we're at. So our next steps are for, if you can give us some idea, is this something that you have an interest in? Is it a concept that you would like to have available to you? Because it only works if we have carriers available. And so part of what we're trying to determine is how much interest is there, and can we go to a United Healthcare or a Blue Cross and build a case that, hey, it makes sense for them to be involved. So if you would let us know your level of interest, we would certainly appreciate it. It'd be very helpful to us, and hopefully we can make it helpful to you. And let us know, do you like the idea for health-only benefits or for all of your ancillaries, or none at all? So that's what we think are next steps. So to close it up, I want to just give an update on the state exchanges in Iowa and Illinois. As you know, they're both using partnership, what are called partnership exchanges, so they're partnering with the federal government. You're still not seeing much information, but open enrollment is supposed to start the beginning of next month. So we think we'll start to see some information pretty soon. But just by way of an update, in the state, in Illinois, there are going to be 6 carriers participating, offering products in the state public exchange. Blue Cross Blue Shield of Illinois, Humana, Aetna, Carle Foundation, which is based out of Champaign-Urbana, Coventry Healthcare, and Land of Lincoln Co-op, which is a new type of organization that was birthed by healthcare reform. In Iowa, there are also going to be 6 providers. Coventry Healthcare of Iowa, Co-Opportunity Health, which is another one of those co-ops, Avera Health Plan, Gunderson Health Plan, Sanford Health Plan, and Health Alliance Midwest. Now, of those, only 2, Coventry Healthcare of Iowa and Co-Opportunity, are proposing to offer plans that would provide statewide coverage. The other 4 are all regional carriers in terms of their products, and we're hoping in the next couple of weeks to know more about the product designs and the rates. You'll notice in Iowa, noticeably absent are, in both states, United Healthcare, and in Iowa, Blue Cross of Illinois. Iowa. Blue Cross of Iowa has indicated that they are going to participate next year, but not this year. And then finally, relative to those exchanges, by October 1st, there is a exchange notice that you have to distribute to all employees, not just employees on the plan, full-time, part-time. We are working with our clients. We'll be sending out a notice of what needs to be done with some instructions either later this week or next week. We've frankly been holding off on this because we really didn't want to have employers distribute it and then employees coming in saying, well, tell me about this exchange, and you having to say, well, we don't know. We don't know anything about it. There's no information available. So it's our feeling if we can delay it as long as reasonably possible, hopefully by the time it's distributed to your employees, we'll have, there'll be information available so questions can be answered. You're not having to deal with the same issue twice. And the last thing, I want to bring this full circle relative to ARC series, is I've highlighted on the screen, you'll notice that in that federal exchange, their federal notice that goes to employees, in there they're saying, hey, if you have questions about your benefits and your coverage, go to your summary plan description or contact someone in your office, at your organization, the name to be filled in. So you can see even the federal government now is pointing employees towards those summary plan descriptions. So it is so important that you make sure that you're in a compliance status that is good, that you have that information. It's a good risk management process to make sure that you're in compliance. But I just wanted to bring that full circle for you so that you could see how that is working, how important it is that that be taken care of. The last thing, then I'll close the webinar series, is you may have seen something over the weekend about some new regulations that the government have put out relative to information reporting. And I just wanted to touch on that. What's happened is, as you know, the government has delayed reporting until 2015. But what came out last week is they're trying to find some ways to streamline the annual information reporting that you are going to be required to do as an employer. And so what came out last Friday from the Department of Labor were some proposed regulations where they're asking for comments about here's how they're proposing to streamline operations and what you would have to report and when you would have to report it. And so we're in the process of reviewing those regulations, and if there are comments we think need to be made, we'll do that, and we'll keep you advised. It's not something that you need to be concerned about or acting on immediately, but we're going to have to adopt a little bit of a wait-and-see attitude to see what the reporting requirements are, and then from there we can talk with you and your payroll and administration vendors to make sure that you've got a good, efficient way to report that information out of your system when that reporting comes due. So we've got a little bit of time. So thanks for being with us today. I want to remind you that Part 4 of our series, Your Response to Healthcare Reform, on claims data analytics, how you can use your claims data to better manage your cost, to better understand the risks of your group, to better make plan design decisions, has been rescheduled. Instead of this Thursday, we've moved that to September 26th. We think we can have a more robust presentation for you then. So hope you found this helpful. We appreciate you having spent the time with us today. And if you have any questions at all, please reach out to us at Group Services, and we'll be happy to help you in any way you can. So thanks again, and this now concludes today's webinar. Have a great rest of the week.